know, my name is Tracy Thomas again. I'm the business manager, office manager, communications support to the executive board with the chamber. Honored to be here today and glad to see all of you on this call. Just a little bit of housekeeping. We're going to make sure that your microphones are muted when you're not speaking. There will be a Q&A at the end. I'm so happy to see that all the cameras are on so we can see all your beautiful faces. I would like to get a selfie as well of everybody so that we're able to share who has been participating on this call. And any type of questions that you have or comments, you can leave those in the chat feature. So I am going to move on to our actual sponsor for today's event. We have Frida Lucas, who is the Vice President, Branch Manager of PNC Bank. We are honored to have them as a corporate sponsor for the Chamber. And at this time, I'm going to ask Frida to say hello.
Well, thank you, Tracy. We all know that 2020 was perhaps one of the most difficult years of our lives. And 2021 is full of challenges too, with the ongoing isolation created by the pandemic taking a toll on all of us. Although we're seeing so much hope ahead of us, challenges continue. Now, it's been said that the key to getting through challenging times is to be resilient, whether we're dealing with the stress of everything that's going on in the world right now, or issues right here at our home or in our personal lives. But striving for resiliency can be a challenge, which makes this a great time to talk about mental health, especially in the workplace. Experts believe the impact of this isolation will have long-term effects, which is why PNC Bank is proud to support and bring to you this important topic and discussion. Thank you all so much for allowing us to support this most important topic. Thank you, Tracy.
Thank you, Frida. And I failed to mention that Frida is also a board member of the Black Chamber. So again, thank you for that, Frida. I'm going to go ahead and introduce our speaker for today. Our speaker is Janice L. Griffin, who is a licensed social worker and owner of Living Solutions Consulting, LLC. She is experiencing crisis intervention, working with elderly, treatment of various conditions such as anxiety, depression, life transitions, and related matters. So at this time, I'm gonna bring on our speaker. Welcome, Janice.
Thank you. Hi, everybody. Okay, I want to know, make sure everybody can see the screen that we're sharing. We're all good?
Yes, ma'am.
All right, so what I need to do here. All right, the two faces of need in the aftermath of the COVID-19 pandemic. I must say I am being a little optimistic when I say aftermath, but eventually we'll get there, but it will be a new normal. So the two that I'm going to focus on is anxiety and depression because they're the most, they are more prevalent in our society, and also they are the beginning to other emotional health issues, okay, like trauma, that's very much related to anxiety, suicidal intentions and things that can be related to depression. So these are like kind of like the foundation, and other diagnoses spring off of these two. Okay, just a little bit about me. Tracy said, that's just my education. If you guys want further information, I have my card at the end, but that's just a little bit about me. And here we go. Definitions of anxiety, characterized by tension, worried thoughts. I'm sure all of us have not only witnessed it in friends or family members, but we have possibly experienced it ourselves. Perfect example is if you worked like a salaried job, 9 to 5, and let's say 4:45, your employer asks you to come into their office to have a conversation. the average person usually experiences some kind of anxiety because they fear, okay, why am I being called into the office? Okay. Depression, most of us have pretty much experienced that as well. It would manifest itself not just in sadness. People with depression may experience a lack of interest and pleasure in daily activities, weight loss, gain, inability to sleep, or excessive sleeping. And I put these definitions here because for employers, you'd be able to notice your client, your employee's baseline. And these two things are very obvious to notice if you see a change in your employees. Is everyone with me so far? Okay, because sometimes I can go off. And the references are at the end of this. Okay. Oh, the one thing I wanted to point out, depression is the most common mental health disorder. Okay. And we all experience it. Okay. I wanted to put in a few statistics here on the effects of anxiety and depression. There's been and this is all related to COVID-19. Since the inception of this pandemic, there's been a threefold increase of anxiety and depression compared to pre-pandemic levels. Close to 41%, that's almost half of almost 6,000 people have reported adverse mental or behavioral health symptoms. I wanted to try to get current stats. So we'll see, that was February 23rd. I would say those are the people they're surveyed. The number is probably higher than that, maybe 60 or 70%, okay? 33% of adult respondents reported anxiety or depression symptoms, and close to 30% reported experiencing COVID-19 trauma related. And that is something I think we all should keep our eye out on, because once Pam, I know you were at the Action Alliance meeting that we went to where they talked about the shadow pandemic. We will see the big manifestation, the trauma, when we're so-called back to normal, because that's usually when those symptoms of PTSD will show themselves more. Number 3, 15% increase in substance use. I would say that's higher than that. It's self-report. People are not always going to tell you when they're abusing drugs and alcohol. Suicide attempts or suicide ideation, there's been an 11.9% increase. And then last but not least, this was conducted before the COVID-19 pandemic and the early weeks, like in March, about a year ago. The prevalence of depression symptoms increased from 8.5% before COVID-19 to 27.8%. And again, that statistic, that number is higher than 27.8%. Okay. All right. What I'd like to do is just give a quick case scenario before we go into Q&A. This is a referral that I received last summer. And it was about, I guess, 3 months into the pandemic, maybe around July. And it was an employer of a local daycare center here in West Palm Beach in the Northwest. Out here in, like, they call it, I think, Caribbean Village, in that area there. She contacted me because one of her daycare workers, she noticed that she was away from her baseline, how she normally behaves. And she reached out for some assistance for her employee who works with infants, at that time was working with infants. And because of COVID-19 and the school closures, she had to bring her 9-year-old daughter to work with her, which is a stressor in itself, okay? And her 9-year-old daughter had issues as well. So 28-year-old African-American female, she has a 9-year-old and an infant daughter. She brought her daughter to school because of COVID-19. The employer reports in recent weeks, client has been displaying daily behaviors, tearfulness, agitation, and lack of focus. Classic signs of depression. Client's behavior is impacting the infant's moods and overall stability in the nursery. For those of us that have been around babies, they feel your energy. So if she's in a room with 6 or 7 infants and she's crying or just acting nervous and things like that, the owner of the daycare noticed that the babies were aggravated more. That was another reason why she paid attention to her employee. So it's like we're all connected. And the 9-year-old daughter, as I said before, she was experiencing some problems in herself. And so what I did, unfortunately, the client, this is the socioeconomic end of things, is I could tell that there were some problems going on at home. She was uninsured, and so she would have to pay out of pocket. And I was going to work with her on that. We were all clear. And then the day of the appointment, she didn't show up, but she went to work and was telling her employer that she had been seeing me. So there were some bigger issues going on there. And luckily, like what you all are doing here, just getting the understanding that you can have an impact, at least I hope that's what I will be able to leave you with here. My employer was, her employer was smart enough to know, okay, Janice, she's not really gonna open up to you, so I've gotta find another place to go to get her help. What I was able to do for her 9-year-old daughter is refer her to the Center for Child Counseling, because the daughter was acting out in many ways. And I think that there was probably some kind of abuse that was going on in the household and could have been even before COVID-19. So we wanted to make sure that the little girl got assistance, and then the employer was going to work with resourcing her employee out soon, but she did remove her from the infants. Okay, so as far as an intervention, other than resourcing her daughter, I didn't really get a chance to work with the employee because she just wasn't being honest about, or not connecting with me, but telling her employer that she was. So there are some bigger issues going on there too, why she would lie about that. Okay, so that's a real life situation, and you all may run into things with your employees that you'll notice something's going on. Okay, so here we go. These are a few tips I'd like to give you. Know your employees' baselines. And what I mean by baseline is know how they typically behave. If you have someone that's showing up, always shows up to work 15 minutes before clock-in time, and now she's barely getting there at her actual time that she's supposed to be there, or he or she is coming in late. If you notice moodiness, and of course, look for those signs of substance use. So the key is to know your employees' baselines. Make note of any marked change in behavior. A big way of knowing something's going on, if you have someone that does quality work and you see their work go downhill really fast, chances are there's some mitigating factor that's involved there. So once you notice the behavior, if necessary, follow your gut and have a conversation with the employee. One thing I will caution you on is try not to initially go to other coworkers to say, have you noticed such and such, this and that? Because people talk and rumors get around. Go to your employee first and see if they will reveal what's going on. And then the next step, you can go check with others. Is everyone with me so far? Because I'm trying to make sure I get through this. This is the last screen, and then you can ask me questions. Okay, good. I can't see everybody else, so I just see Pam and Frida. Okay, so as it says, if necessary, follow your gut and have a conversation with him or her first. Listen to what they're saying. And then if all else fails, reach out to community services for help. It takes a village. And that's something I will say that the community needs to do more, to pay attention to, don't just write it off to substance abuse, or he's just crazy, he's just acting out, or she's this or that. 90% of the time it's something else going on, and it's something that is treatable. But we have to pick our head up out of the mud and realize that, we all have mental and behavioral health issues at some point in our lives. Okay, and then some of the resources, 211. Sorry, I did the abbreviations, but it just saved space. West Palm Beach Mental Health Coalition. That's Mrs. Pam Frazier. NAMI, they're a really good resource. Mental Health Association of Palm Beach County. And I do have a link for SAMHSA. They have a master national list. And really quick, psychosocial determinants. When you do have an employee that presents in a different way and something's going on, micro means on an individual level. It doesn't necessarily have to be her with the problem. It could be, I don't know why I keep saying female, it could be an errant teenager that's causing the depression or the anxiety. Or it could be, back to COVID-19, it could be that he or she's the only one working in the household, and they have 5 kids, they can't pay their rent, and the landlord's ready to kick them out. That's more on a macro level, because the pandemic is affecting everybody around the world. And then on a meso level, that's more, could be family stuff going on, neighborhood stuff. Could be 2 neighbors don't get along. One wears a mask, the other one doesn't. All of that could be impacting your employee. So I guess that's it. If we're ready for questions. And it's 12:22, my clock says. Are we good, Tracy? And
yes, we are good. We are good. So we're open for any questions that you guys may have that you would like to ask. This is the time. We can talk. You can just unmute your microphones.
Hi, this is Beverly O. I've got 2 questions, actually.
Sure.
One is, and maybe it's something that can be accessed via one of the links that you're providing, but I know that some sensitivity training that we've had on the job that gave tools to employers on how to speak with their staff if there's a concern for a problem. There's some sort of sensitivity and care as to what you can discuss and how you approach them and how you discuss with them to get to the heart, hopefully, of what might be troubling them. Would something like that be included in any of the links, resources that you've provided, or can you point us to something like that that might be helpful, or is it just not necessary because it's COVID and it's just so widespread?
Well, no, that's a very good question. I don't have one resource I could link you to now. And these, I would say the top 2 references I have, if you can still see the screen, is the American Psychological Association. If you open that link, you could probably Google that.
Okay.
I mean, you could probably search it. But if you'd like, if your email address is available, I can get some more in-depth. It's like role playing,
right,
type things where you will know if that, you can at least prepare yourself for the conversation.
Right.
So you can either search APA or get me your email address and I will send you some information about that, and whomever else may be interested, because that's a very good question. How do you start the conversation?
Okay.
As I mentioned in the presentation, what you want to do, though, is make sure you go to the employee first with your concerns. Now, I would tell you how I do intersensitive conversations with clients that may, let's say, I I work with Medicare patients, and a lot of times I have to work with their adult children, and they will tell me that about needs that their loved ones have. That's where I get the referral from. But the mother or father, they don't want to hear it because they're okay. So
Right.
I have to come at them in a way more, I would say, use an I message. Now, this is just from me, how I do it, but I will follow up with more information to you if you like. I'm noticing, and this goes back to the baseline behavior, point out whatever that behavior is. I would say, first of all, start with a very pleasant, being a
Demeanor.
pleasant, a worried look or anything like that. Calming, because energy does spread.
Right.
And, I'd like to talk to you because it could just be my gut, but it seems like you're different. You used to go out to lunch with your friends, and now you're sitting here. I noticed that you spend an excessive amount of time on the phone, and I thought one day I saw you crying. Is there something going on? And again, it's about what you feel.
Right.
You got something going on.
Right. Okay.
All right.
That's very helpful.
Yeah, that's a starter. And again, I can get more information to you, but I think even in apa.org, you would be able to search and find a lot of information. That's
Okay.
why everything I put in here, you all will be able to go and get it, not just take my word for it, but be able to do your own research as well.
Okay. Wonderful.
Right. Hope that helped, Beverly.
Yes, that's very helpful. And my second question goes back to, you had mentioned something like if you observe certain behavior, there are agencies that you call that you can reach out to help. And forgive me if I'm misunderstanding this, or to report behavior that you're seeing?
That's a good question. Now, reporting is I would say if you see something going on, you go to the Department of Children and Families. They have a hotline number. And you know what? I didn't put that in my in my list. Okay, but yes, Department of Children and Families. You can, if you want to, because I would say be very careful about filing reports. First, go to the individual.
Yes.
Then if the individual isn't helping you, if you happen to, let's say when you hire them, you get emergency contact information, reach out to that family member or whatever, find out what's going on in that manner. I guess I need to back up a little bit there. If you think it's like physical abuse or sexual abuse, then you may not want to reach out to the family member because they may be the abuser.
Right.
So it just with that disclaimer, but in many cases, that's not what's going on. And they can tell you if they see something different. Usually they reach out, but I don't want to discourage you from going through the other agencies if you do suspect some kind of abuse, because as many eyes that can be on that situation as possible is not a bad idea as well.
Right.
You know what I'm saying? But the DCF is where you file your formal complaints, whether there's kids, young adults, middle-aged adults, or older adults. Everything goes through DCF.
Okay. All right. Wonderful. Thank you.
You're welcome.
If I could just throw in another question, are we going to get a copy of this presentation?
Yeah, I did say it initially because I thought who'd want to see a presentation, but yes, I was hoping you would like that because I did dedicate some time on it. And Pam, I have to ask you, did I make this like easy, more user-friendly? Because I thought about, in one of my other presentations, you were telling me to kind of talk in that terms that everybody will be able to get. So I really tried.
I think you're doing fine.
Thank you. Yeah, I try because I value what you say, and that when you work in a field like all of you do, I'm sure Frida, PNC talk, and you'll talk to somebody like me if I want a mortgage or whatever. I'm like, what is she talking about? So I wanted to
tell everyone, Janice, if I can make just a quick statement. Janice has been very helpful when I was prior to March of last year, holding open sessions at Cityside Suites once a month on various mental health providers would come in and make presentations on what they do. Janice is and it wasn't stated, I don't think, in her dialogue, but she was a former employee with Jerome Golden.
Oh, yeah, I
And
did.
Jerome Golden, as many of you know. And what I liked about Janice, everyone else would come in from work, they'd be dressed down and, ready to just relax. But a lot of times Janice would have to get up and leave because a lot of times she was going out on call and meeting with people, even on the street, who had been Baker acted or being able to take them someplace. So even though, she's not getting involved in a lot of that discussion, she has a lot of capabilities, because I have even had her work with me, and things were happening even in my own family. So I believe in what she does, and I felt that she was a true person to be able to talk with you guys today.
Thank you.
Well, I'm just going to say I'm very thankful. This has been extremely helpful. And I am a co-founder of an organization called Dynamic Outcomes for Exceptional Students. And we are looking to be the hub of resources for what are now called exceptional students, what used to be known as learning disabled, special needs, so forth and so on, and their families. And so the anticipation of things that we might encounter in that family dynamic, this just is extremely, extremely valuable and very helpful.
Good, good.
Okay, we can take a couple more questions. We're
Sure.
good on time here.
Yes.
Okay, I'm going to ask another question. So with these wealth of resources, which are great, the question that keeps popping into my head is, what is there any help in sight for just helping? I don't know how to phrase this. Just that it's gone, the pandemic has gone on so long. You've got people that were able to weather this and kind of ride it out from the beginning, but with extended time, it's begun to fray and wear at the fabric of, families, workplace, just everywhere. And I just wonder how accessible can help be to these people that are suffering, to get counseling, to have someone to talk to provide actionable things to help them just kind of navigate this and not spend their time, 90% of their time being depressed and feeling isolated.
Right. And that's a very good question. I want to just add something first before I answer. That's why earlier in the presentation, I talked about the stress related,
Yes.
trauma related.
Yes.
That's what you're talking about. Because once we get through this, that's when you're going to see what you're probably seeing now and how it travels through the family and through the community.
Right.
People are going to have a collective mini breakdown, probably. I hate to say it that way, but it was like in the presentation I referred to about the shadow pandemic, while we as clinicians are preparing for that. Now, how you get the help, again, the resources I gave listed there, there's a lot of information there, but if you want to do more locally, my business card is here. You can always reach out to me. I can talk to you individually about what I do within my agency.
Okay.
But what you can do, and this is where I'm glad you mentioned Jerome Golden, Pam. This is where they were so valuable in having a psychiatric hospital up here in the northern part of the community. Was so important because people could just walk in. They could walk their family member in, or they could walk themselves in and get treatment. True, we have JFK North and St. Mary's. They have a psychiatric ward, but they are for profit, and they're just not all about people, not everybody has health insurance. And Jerome Golden and South County Mental Health Center in Delray, they were able to, and South County still is, they were able to see people that did not have insurance do sliding scales. So what I would say is there's, in this area, oh God, on Forest Hill, I think there's multilingual. There's several other ones that are locally that 211 and the other resources would have. I would say if you have someone that has a problem, it's if you know someone that can refer someone to you that you have faith in, and again, I'm going to toot my own horn. If I can help you, I can definitely guide you to someone that can, and that's everyone in this audience. But 211, West Palm Beach Mental Health Coalition, all those other ones I listed, that's a place to start. You get the person to help. If it doesn't click with the therapist or whomever, then you can change, but just get them in front of somebody.
Okay.
That's Did that help?
Yes, thank you. That's very helpful.
Okay, we have time for one more question.
Janice, it's Frida. I know you mentioned about, real briefly about a Center for Children Counseling.
Counseling, yes.
Yes, because what I'm discovering, a lot of conversation around children being home, and it is affecting the employee's work relationship because the child is suffering.
Yes.
So this particular department or place you mentioned, how does this look with contacting them or us reaching out or at least providing that information to our employees?
It's their website is very informative. Center for Child Counseling, and they're here not too far. I think up here off of Haverhill and 45th Street. They are Medicaid providers. And if you're looking to service people that are typically normally uninsured or they have Medicaid, this is the place to go, okay? Because they service all communities. Okay, and they have the play therapists. I wouldn't even have mentioned their name if I didn't think highly of them. And also, you know, I went through my training and stuff with a lot of the clinicians there. They have really helped in some high profile kid cases here. They were the counselors that assisted the family members when there were big cases of abuse and things like that. So that's a really good question. And if you want, well, just Google Center for Child Counseling, West Palm Beach. It's very easy. And they would even come out and do like a Zoom type thing here if you want it. There's many licensed clinical social workers like myself, but they also have mental health counselors and, you know, different specialties as well, only working with children. That's what I like about it. That's all they do.
Excellent information. Thank you, Janice.
You're welcome.
All right, so we're good with timing here. I just wanted to move on this agenda where we're at as far as highlighting a few of our newest members, and we have a couple of them that is actually on the call as well. So that's awesome. Let me just announce our newest members real quick. We have All Lines Business Solutions. We have Blue Mountain Coffee House, Compass Community Center, Dunstan Independence Insurance, JG Estates LLC, Progressive Capital Lending. We have Roundtree Training and Consulting. And I believe I've seen Ms. Roundtree that's on. Ms. Roundtree, you want to say hi?
Good afternoon, everyone. Happy to be here. Great information, especially due to the climate that we're in. I think this presentation is warranted and needed in many venues. So I really appreciate the information. Thank you.
Thank you. Thank you. And we also have the West Palm Beach Center for Arts and Technology, who is also one of our newest members. And we also have a newbie that's on, Maureen McKenzie. I don't believe we've ever had the opportunity to see or speak with Maureen. Maureen, you want to introduce yourself real quick?
Hi, good morning. How are you?
Good.
My name is Maureen McKenzie. Janice, this was a great presentation. It's well needed in our community today. I mean, so many things has happened through the pandemic and still is happening. But I am with New York Life, and I have worked with individuals, business owners, and even within the community. Tracy, I've had the opportunity to meet Tracy about 2 years ago. 2 years ago,
Yep.
and she has been such a great entrepreneur. She have worked so hard within the community. I've been to Rosemary, and I've seen the work she has done and still doing. So it has been an honor to be a part of this group, this chamber, and I'm hoping to do much more within the group. Thank you.
Thank you, Maureen.
You're welcome.
All right, so that's it as far as our newest members and highlighting our members. I do want to make one announcement. June is Caribbean American Heritage Month. So what we're doing now is we're looking for nominations. You're a chamber member and you're a Caribbean American in business. We want you to recognize, if not yourself, another chamber member that's an American, Caribbean American individual in business. I'm going to drop the form. There is a nomination form that you could complete. It is on the website, but I'm going to drop it in this chat. I'd love for you guys to start sharing that and getting that out there to the communities. And again, these are chamber members, but if they are not a member, this is an opportunity for them to become a member. Okay. So in closing, I'm going to go ahead and now bring up our board chair, Grassford Smith, for closing remarks.
Thank you, Tracy. And as was said, you're doing a phenomenal job.
Thank you.
I also want to thank PNC and our board member, Frida Lucas, for, again, making this possible. I see other board members on, Joe, Bruce, all working very hard on behalf of our members. And I'll just piggyback on what Dr. Roundtree just stated. I mean, this is an important topic. I would say probably one of the most important topics we've tackled this year in the Wednesday Wisdom, because we know a lot of folks are suffering in silence. And hopefully the resources that you all learned about today can help somebody. And, you know, as a chamber, we understand that we have to address people holistically. If you're not healthy physically and mentally, your business probably will suffer. I'm gonna venture a guess. So we are here to provide you the information you need. Ms. Griffin, you did an awesome job. I appreciate you being available, and we definitely want to maintain the relationship with you. I think this is not a topic we can cover just once.
Right.
So I think we need to think about an opportune time to have you come back and share with us some more. So I'm definitely grateful to you, Ms. Griffin, for being available. I'll just note that in addition to Caribbean Heritage Month, and I'm Caribbean born, so I want to put that out there. But in addition to that, you know, we have a lot of exciting things going on. We're working on our website. Our newsletter has gotten tons of positive attention. So pay attention to what we're putting out, and by all means, join with us, and we'll look forward to working with you. So with that, I guess we're going to get you out of here a little early today. Ms. Griffin, you were efficient in your presentation.